To break down this high-yield case together, we have a 2 years old girl, and she presents with sudden onset of pallor, fatigue, and decreased urination. She had a recent episode of diarrhea after eating under cold beef. Labs show hemoglobin level of 7, platelets are 50,000, creatinine level is 2.1, and blood smear shows schistocytes. Which of the following is the most likely cause of her condition? A. IgA nephropathy. B. Shiga toxin producing E. coli. C. Minimally change disease. D. Membranous nephropathy. So now, guys, pause the video, try to figure out the correct answer, and play the video again. So the high yield keyword here will be a 2 years old girl. So we have a child, we have a kid, and she presents with sudden onset of pallor, fatigue, and decreased urination. And she had a recent episode of diarrhea after eating under cold beef. So we have a history of diarrhea. It's very important. And also labs showed hemoglobin of 7. So we have anemia here. And platelets are 50,000. So we have thrombocytopenia also. Creatinine level is 2.1. So we have some sort of kidney injury. And smear shows schistocytes. So we have some sort of hemolysis also. So all of these keywords, guys, make the answer to be B, which is Shiga toxin producing E. coli. The right answer. If you see a child with recent diarrhea, which mostly will be bloody diarrhea, and microangiopathic hemolytic anemia, and schistocytes here is a sign for microangiopathic hemolytic anemia. And also if you with thrombocytopenia and any sign of acute kidney injury, which is a high creatinine level here, you should think about hemolytic uremic syndrome or HUS. And the most common cause of HUS in children is Shiga toxin producing E. coli. And it's often serotype, which is O157H7. So if you see these symptoms here, you should think about HUS. And the most common cause of HUS in children is Shiga toxin producing E. coli, which is the right answer here. So let's review some high-yield information about HUS recently. The first thing that you should avoid antibiotics and platelet transfusion in HUS cases because it may worsen macrothrombi. So if you see antibiotics in the choices, it is the wrong one. And treatment here will be just supportive. So it will be fluids and dialysis if needed. So it's just supportive treatment and management. And this serotype of E. coli does not ferment sorbitol. And this is also a high yield information. And a classical clue you will see in MBME exams. So take care of this point, which is not fermenting sorbitol. And the wrong answer here, A, IgA nephropathy. So it usually follows urinary tract infection, not diarrhea, and also causes hematuria, not macroangiopathic hemolytic anemia, not hemolysis, not thrombocytopenia. And C, minimally change disease. It is a nephrotic syndrome, so you will see signs of nephrotic syndrome like edema, you will see massive proteinuria, but not hemolysis and no thrombocytopenia. And D, membranous nephropathy, which is also a nephrotic syndrome, so you will see also edema and massive proteinuria, and there will be no anemia, no schistocytes, no low platelets. So this is all for this case today, guys, and I hope you the best in the future.